All right, Dr. Malone, we had a weekend full of percent positives, so I felt like it might be a good idea for us to get back online and chat since everybody's getting their kids ready for school next week. And the CDC says that your community should be 5% or less before schools reopen. And we are hovering around 20% percent positive in Escambia County. Somebody had mentioned to me that they think some of that had to do with the numbers from the jails. I don't know if that's accurate or not. Do you know anything about that?
I don't, other than knowing that the percent positivity coming out of the jails is being reported as being higher, like statewide. And also, I think the other perhaps confounding variable, I mentioned this over the weekend when you and I spoke, was some of the rapid testing that rolled out in the last couple of days. I don't know if that had any impact on any of the numbers at all, good or bad. I guess we'll find out. Looking back, as they continue to implement some of this rapid testing, if we continue to see some of this increased positivity or not. So it's
Right.
either the jails or both of those, for all I know.
Well, all I'm telling you is the official numbers from the county suggest that our county is hovering around 20% positive from the tests that are done over the last several days.
Mm-hmm.
So the concern I have as a parent, and I think parents would be asking is, okay, well, if the CDC says it should be 5% in your community before you consider sending your kid back to school, and we're hovering around 20%, what does that mean? I mean, some parents are like, it doesn't matter, what are the chances, blah, blah, blah. My kid wants to get out of the house. I get all that too. But there was a JAMA article that I saw referenced over the weekend that I asked you to pull yesterday, and it basically says, yeah, kids don't get the virus as much, and then they get it, they don't have symptoms as much, and if they get symptoms, the symptoms aren't bad. But FYI, this study found that kids 5 and under, I believe, actually carry more virus load-wise than other kids their age, other kids older than them.
Yeah.
I'll
pull it up real quick here. This is what you're referring to, and we'll link it as always. And so it's the basically the nasopharyngeal swabs, which is sticking it down your nose into the very, very back of your nose and your throat. This is what they were comparing the viral load, basically. And what you're referring to is, let's see here. I think it said, it might be on the next page, apologies. So what they were saying is that they can carry up to 100 times the viral load of an adult who's got the same infection. However, yeah, they weren't seeing the symptom onset or the illness. But the last sentence here says the behavioral habits of the children, close quarters in school, raise concerns about further amplification and spreading this, as well as far as public health is concerned.
So if you're a teacher, look, I know at the end of the day, all these studies, you got to take them with a grain of salt, right? Because everybody's pulling these studies out of nether regions because everybody's trying to get a grasp on this novel coronavirus, right? So everybody wants to make scientific sense of this virus. And most of the time you can't really get a firm handle on stuff like this until, after the fact, well after the fact, when you've got all the data in. But I think a lot of scientists and doctors are trying to get some idea based on what they have so that they can then share that with the public so the public can, take care of themselves. This article seems to suggest that kids under 5 have 100 times more of the virus, and they're also more likely to not be careful about sneezing and coughing in your face and other social norms that would prohibit the spread of the virus, not wearing the mask perhaps as well as others, not distancing as well as others, those kind of things. And I think teachers should be aware that that's the case.
They drew a parallel to RSV, and I'm sure most parents have heard of RSV, where their kids had it, and this is just something that's very common. And they say that just as RSV is spread amongst the same age group, they think that this virus could be spread the same way and to be a driver for infection, because then those newly infected children then take it to their home environment, to wherever they reside, then playing with other friends when they're not in school. So that's, I guess, the impact that you would see from that. The other thing that they brought up, and this is actually a good point, is this would be a reason why you would think to consider some of the younger kids to be the vaccine candidates sooner, because
Right.
it's kind of like a high target environment. Like, wow, let's get the really, really densely infected individuals to be vaccinated first, so that we stop that spread at the root. If that's one good part of this article, I guess.
Right. So they opened a couple of schools in Georgia, and they had some spread. They had to close the schools down last week. I'm not sure where they are with that. Anyway, everybody needs to be careful and pay attention to what's going on. Make sure their kids know the masking and 6 feet protocols and washing their hands constantly, that kind of thing, for sure. So what else do we have, Evan, today?
So I was going to share just a couple of the graphics. This is, I guess, the release from today that shows the county, and this is what you're referring to, over the weekend here. So Saturday is when we had the record high for the county as far as a single day, the 548 release, which, as to where that number came from, like we talked about at the outset of the video here today, whether it's jails or whether it's the rapid testing or a combination of both. So that was the scary jump there that we saw. But then scrolling further down, as you were mentioning, was the percent positivity. And I think on Friday we talked about 20% being our highest, and then we again outdid that on Saturday, and really haven't gone down a whole lot. And I think that 17-18% is much higher than we've been all through July, even on a single day. So we have 4 days in a row here where the percent positivity is really hitting its max that we've seen. So that's the one scary.
Moving in the wrong direction at this moment, and we're going to open the schools.
Which
I'm not saying it's the wrong idea. I'm just saying.
Yeah. And then this, not to say that this changes anybody's mind or anything like that, but this is statewide, kind of where we've been since March. So, you can see where the two big peaks have been. If you remember, I guess in the office here, it was the first week of July, and we were like, time to go back home, guys. And we worked back at home and watched it go back down. So this is just like a good historical look back at how things have gone trend-wise, with the ER visits and people's symptom profiles overlaid on the calendar that we've all gone through. Other stuff that I thought would be good to share would be, this is the county comparison, and it's not searchable by percent positivity, but you can see by how many infections in each county. And then if you look all the way over, you can see the percent positivity. And this is over the collective of the time. So it's not the real-time measure. And we've already had this discussion before, but the Escambia County is still over the whole time is 13%. So we're nowhere near the 5%, and that's if you dilute it out over however many months since March. Wow. So we're not near the 5%. This is if you're using 5% as your current peg, we need to get down quite a bit to even average below that. So that is kind of where we stand, and you can compare some of the other counties where there's huge infection rates, and Palm Beach, huge infection rates, and they're 13%, just like we are. So it's the percent positivity, I think, which you could be the least populated or most sparsely populated county, and it is 13%. That's still important. So this was from today's publication.
We'll link that journal article below. What else do you have for us?
Yep. So this one came up, and I think we've seen something like this that I shared last week, and this is a pretty good masking kind of analysis. They're actually trying to come up with a way to study how masks work the best, and so this is a science magazine, not a medical publication, but these folks are trying to figure out which masks work the best. And so if I go to this one graphic here, this is the important one. The droplets spread with a certain kind of masks. So all the way to the left is the fitted N95 mask, and relative droplet count and spread is basically like 0, right? And then surgical masks, and then it goes all the way. And we're basically saying that if you're going to wear a cotton one to layer up, you can wear 2 cotton ones, or wear like one of those neck gaiters that you can fold over on itself a couple of times. And interestingly enough, as you go up, people that are just wearing just like the single bandana, single layer, it really not, you're doing benefit, because that green bar that says none, that's the virus spread if you're not wearing anything. So you're doing some benefit. The only one that actually does worse is the fleece cover-ups. And
how does it do worse than nothing?
From what I saw, is apparently the fleece itself can somehow like shear the air a little bit and create some more disturbance, so that more particles can get out and spread even more. So it's on a very microscopic level. So if you're thinking that the fleece gaiter that you've got, that maybe you wear in the wintertime only, and you're pulling it out now, it's probably not the best choice.
Not to
everything
mention
else,
it's 900 degrees outside.
yeah, exactly. Everything else gives you a benefit, some more than others, but they use this as a way to kind of try to track, what was best. And again, this goes back to, I think we've mentioned masking at least once a week for the last many weeks, where, this is the one thing you do have control over in your own day-to-day comings and goings. So I recommend, if you're going to go through the exercise of wearing a mask, do it right. So we'll link this article as well. And then lastly, this came to mind here at the office. We did our morning testing, Monday morning testing, as Joe will tell you. And this came up as far as the option for hopefully some new testing coming out here on saliva, where these folks developed a saliva test that works on the PCR, the viral RNA, but not having to rely upon a single source for like reagents and test materials. So they've made it so that it can be used with any reagent, any brand, any test material, and they're really trying to make it so that there's no interruptions on the testing, and it's a rapid, more reliable than the antigen or antibodies. You're still getting that PCR test, and this is a Yale study. And hopefully it gets pushed through by the FDA and approved for some sort of use.
Back in April, I was complaining, if you go back and look at the video for this, April or May, I was saying, look, until we have a test, it's like a pregnancy test, where we can do it at the office, but just give it to somebody before they walk in the door and say, you got to take this before you come inside. That's what we need. And that's exactly where I think we're going to end up, unless we get a vaccine before that. But I wish we had invested as a country a significant percentage of money into not only finding a vaccine, but the testing and tracing that is needed, in my opinion, to control the economic effects in the interim. But we didn't do that. So are you going to link this article too?
Yeah, I already gave this link to Michelle earlier, and so it's just an interesting read to say, now, I guess, the time to innovate was a while ago, but it's always a time to innovate some more, and I guess we've at the office here become intimately aware of the different testing modalities, and so this is one that I think would be great if there was no interruption. It was easier to roll out and cheaper, quicker results, and reliable.
I was interviewing a paralegal today. She goes, what type of system do y'all have in place for the COVID? And I'm like, lady, if you only knew. This place is tested more than the Pentagon. So I'm not sure if that's good, bad, or whatever. So I laid it out for her. She was like, oh, okay, I feel safe there. Anyway, we did have another round of the PCR testing at the office today. Dr. Bailey came in again. We had a video with her a couple of weeks ago, 3 weeks ago, and we were able to isolate an asymptomatic carrier that was on the staff. That person has been isolated for 3 weeks now, or 2.5 weeks. And so my hope is she tested again from her car today, and my hope is that she's negative, so we can think about reintegrating her into a masked, distanced office. So, but in any event, my hope is she's not one of those people that carries it for 4 months, right? I know she doesn't want to be that person either. But
Well, and I'll also add that, we again, to your suggestion, did the questionnaire as well on top of the testing to try and not really pick on what people have done or elected to do over the weekend, but really just to identify, say, is there anybody that we need to be extra cautious with while awaiting some of this testing? And so that was something that we've tried to implement. I know a lot of other places are relying just on the questionnaire. So I think we have a dual layer that we're going through.
Yeah, I don't feel comfortable asking people to come to work, and even if they're masked and distanced, which we are, unless I can show them, look, everybody's tested here and they're all negative. So,
Mm-hmm.
of course, you can get it walking outside to lunch.
Yep. And then
that's why you need to stay masked and distanced. But
exactly.
But at least every couple of weeks or every week, we know that everybody's negative. So that gives everybody some level of security. All right.
Yep.
Well, I don't see us coming back online to this week about this, Dr. Malone, unless that percent positive keeps going up. I hope it doesn't, because we're headed.
I hope it doesn't go up above 25%, because then we're in trouble.
Yeah, I don't see how we're going to open the schools next week if all this is headed up, because it means that not only means the schools are open, that also means that more people are probably going to be leaving their house to go to work, which is a recipe for disaster if you got 25% positive and it's trending up. So anyway, all right, Dr. Malone, anything else?
Nope. Other than I'll just say that if there's any I guess workplaces or whatever out there, to do your homework, do your research, and consider a testing modality for your office.
Yep.
And it was such that we had concierge service today with the one infected individual who literally didn't even step foot in the office. Dr. Bailey met her at the curb, and no one else here was exposed. And I think that's probably the safest way to do it. So I guess I'm proud to be associated with it.
Oh, well, thank you. We're proud to have you running it. It helps to have a medical doctor on staff to run your COVID testing. You came at just the right time, Dr. Malone. All right. So if you have questions about COVID or anything related to these articles or attachments or any personal injury question, you can find us on the web at zarzaurlaw.com. You can call us at 855-HIRE-JOE. Y'all take care. Thank you very much. And stay masked and distanced.